The number one early sign of dementia is something most people have never heard about. In fact, I just recently learned about it myself. This concerns everyone, especially those looking to prevent various types of dementia, including Alzheimer's. Most people know that for heart attacks, the first symptom in over 50% of cases is death because there are no prior signs. The same goes for liver failure. Symptoms don't show until the late stages when it's often too late, and the brain is no different. It takes decades to develop dementia, and in the meantime there are virtually no symptoms, except one which I'll share. The reason is that organs, especially the brain, keep compensating until they can't anymore. The earliest sign of dementia actually involves the retina, which is nerve tissue that extends out of your skull into your eye sockets. The retina has cells that collect information from your environment and allow you to see. Researchers found a strong correlation between changes in the outer layer of the retina and brain problems. These may present as night vision problems, central vision problems. Floaters, light sensitivity trouble detecting shades of grey or distinguishing colours. Often, people just assume they need a new pair of glasses. In some cases, amyloid beta plaque, the same type seen in Alzheimer's, can even form on the retina. They also examined the brains and retinas of cadavers with cognitive decline and found more inflammation in the nervous system, a sign that things were deteriorating. Another fascinating discovery: researchers found high levels of pathogenic microbes or oral bacteria in the brains of Alzheimer's patients. These bacteria come from dental infections or periodontal disease, leaking into the bloodstream and ultimately into the brain. In fact, the same bacteria have been found in plaque in the heart. Why do people die from dementia? Death from dementia often results from infections, such as urinary tract infections or pneumonia. For example, my mother-in-law, who had Alzheimer's, underwent surgery that caused significant stress on her body. After that, her condition rapidly declined. In other cases, dementia progresses slowly. Eventually, a person becomes bedridden in hospice care, stops eating and drinking, and passes away. What can we do? The key is to clean your brain. Inflammation and plaque make the brain dirty. Think of your brain like a dishwasher that needs to be cleaned regularly. The glymphatic system handles this cleaning, mainly while you sleep. So, quality sleep is essential to detoxifying the brain, removing malformed proteins, plaques, and rejuvenating brain cells. Anything that disrupts sleep increases your risk of Alzheimer's. Sleeping less than 6 hours raises your risk of heart attacks, strokes, cancer, blood sugar issues, and type 2 diabetes. If you have sleep apnea, that's a serious issue. I'll link to a resource on what to do about it. You should aim for 8 to 9 hours of sleep per night. According to the book Why We Sleep by Dr. Matthew Walker, even one night of less than 7 hours of sleep can cause a 50% increase in amyloid beta plaque buildup in the brain. Avoid alcohol. Even 1 cup can significantly impact REM sleep. You might feel sedated, but your sleep quality suffers. Drinking a few times a week can impair sleep and increase Alzheimer's risk, while also reducing growth hormone by 50%. Growth hormone supports brain health, weight loss, and anti-aging. Oxygenate the brain. The brain needs oxygen. One of the best ways to get it? Exercise. Regular, consistent exercise reduces hypoxia, which is a lack of oxygen in the brain. It also decreases inflammation, stimulates brain cell growth, and boosts BDNF, brain-derived neurotrophic factor, which is like miracle grow for the brain. There's also a tiny brain structure called the suprachiasmatic nucleus that regulates sleep rhythms. To support it, get sunlight during the day. Start winding down when it gets dark, and consider high-dose vitamin D, around 20,000 IU, to help reset this mechanism. Fuel for the brain. Your brain thrives on ketones, not sugar. Relying on carbs and sugar causes neuronal starvation. You want to enter a ketogenic state by reducing carbs. If you show signs of dementia, take ketone supplements and use MCT oil regularly, which converts to ketones and fuels the brain. Nutrients that support brain health. One of the most important nutrients for the brain is niacin, vitamin B3. Start with 50 milligrams per day, increase gradually to 100 milligrams, and eventually work up to 500 milligrams per day. Go slow to minimize the flushing effect, a warm red sensation that's harmless and due to blood vessel dilation. Some people even find it beneficial.